Welcome to Real Talk with Sarah. In this show, we are going to attempt to tackle an issue that approximately 20% of the population is dealing with: chronic pain. I wanted to have a show dedicated to understanding pain better for a few reasons. One, I wanted to explore what therapies are currently available and to learn more about how they work. But just as importantly, I wanted to do this show in order to reduce the stigma that many people feel when they are suffering with chronic pain. Because many people are living with pain as a result of so-called invisible illnesses, they can often be mistreated by their medical team as well as family and friends. I've got Dr. Jeff Balon of the Centers for Pain Management with me to discuss various treatments and protocols that are available, as well as the biopsychosocial effects of pain. Later, I'll have Roger Deveau on to share a personal story and an all-natural pain relief product that's been helping thousands of people over the last several years. And later, I'll have Marie-Lune Fortin with me to help us understand the emotional side of pain and how we can free trapped emotions that can help us relieve it and further our healing. It's a jam-packed hour, so let's do this. Episode 12 of Real Talk with Sarah starts right now. According to the data, 1 in 5 people is living with chronic pain. While the causes are varied, the impact that chronic pain can have on people's lives is fairly common. They tend to feel marginalized. They can become hopeless, frustrated, and angry at a system that doesn't always feel supportive. I wanted to delve deeper into the topic of chronic pain, and so I've enlisted the help of Dr. Jeff Balon from the Centers for Pain Management to help us understand this complex issue better. Welcome, Dr. Balon.
Thank you for having me here.
Thank you so much for being here. I know that your whole world revolves around dealing with people that are trying to get a handle on their pain. So I wondered if, to get us started, I wondered if you can define pain for us.
Well, pain can be a physical and emotional experience having to do with tissue damage of any sort.
And so when it comes to people that find themselves in pain, is it typically accidents? Is it disease? Is it illnesses? How does it come about?
It can come about from all of those things that you've mentioned. It can be an accident they've had. It can be at home, at work. It can be from just sitting too long. We know that sitting creates a lot of back and neck problems with people as well.
Yeah, oh my gosh, and in today's society, I mean, that's what we're doing, right? We're just all sitting so much of the time. We're not moving. What I love so much about the way that you do your work is that you really have a multidisciplinary approach to pain. You're not, you're an MD, but you're not first and foremost looking at medications. You look at them as a tool, you see them as a Band-Aid solution, if I can put words in your mouth, but you also look at all sorts of other ways to manage pain. So let's talk about the ways that you do that.
Well, first of all, you have to assess the individual and find out what type of pain they have and where you think the pain is coming from. But pain needs to be treated in a number of different ways. So medication is one of the ways. Physical treatment, chiropractic, physiotherapy, acupuncture, massage, osteopathy, and then interventional care, which is more invasive, pain blocks and epidurals and things like that as well. So it's a combination of everything, and then psychological assistance as well, counseling, helping people deal with and manage pain and not let the pain control their life.
Yeah, oh my gosh. Well, I think at the top of the hour I talked about the biopsychosocial effects of pain. Talk about that.
Well, pain can affect every aspect of your life. So if you wake up in pain, it's pretty hard to be cheerful. If you wake up in pain for a long period of time, people often do become depressed, and people will go in, which comes first, the chicken or the egg? Are you depressed because you have pain, or do you have pain because you're depressed?
And so how do you help people in your practice that are coming in saying, I'm completely depressed because of the pain? How do you help them to get out of pain?
Well, I think, again, you look and assess where the pain's coming from. So you try and assist them in dealing with the areas that they have pain generators, so back pain or neck pain, the focal areas that you can help them to address. Medication can also help to bring the pain down as well, different types of medication, and try and get them engaged in life again. So rather than just being focused on a pain score, be more focused on how is that pain affecting their aspects of their life that they want to get back to. They can't play with their kids anymore. They can't have physical relations with their spouse. They can't enjoy work. They can't go to work functions, and trying to make them realize that in spite of the pain, they have to keep going on.
And that's it. We have to keep living our lives. And we were chatting before we started recording, when we went to air, and I was saying we don't necessarily want to hear when Joe or Sally comes into the office. We just want to hear after we say, how are things? We want to hear great. We don't necessarily want to hear not great. My back I'm in agony all the time, or I'm dealing with all of these, pain issues. We just don't want to hear about it.
Yeah, people become socially marginalized. They don't go out with friends. They don't want to go to family functions. They don't really want to be anywhere but by themselves oftentimes, and that's not a very good situation to be in.
That's a really bad situation to be in. So tell us, you and I were chatting before we started, about the 3 different kinds of pain. What are they?
So we have nociceptive, we have neuropathic, and then a new term, nociplastic, or centrally sensitized pain. So nociceptive pain would be mechanical back pain or neck pain, or a sprained this joint where the muscles, joints, tissues have been injured, and that sends a pain signal to the brain. Neuropathic pain is pain generated from a nerve, so that could be herpes zoster or shingles, where you have an area of your face or leg or wherever where you have a pain that's irritating the nerve. Sciatica would be another common type of neuropathic pain. And then nociplastic is actually a new terminology for what we call centrally mediated pain. So if you have pain from whatever source for a long period of time, what happens is the brain starts to turn the pain signal up a bit. It becomes sensitized to pain. It's the brain on fire. So lesser than normal degrees of trauma will cause that brain to sense pain more. And it's in a spectrum, so not everybody's the same. That would be your classic fibromyalgia patient.
Okay, I was going to ask about fibromyalgia. And what do you mean it's on a spectrum? So some people are living with fibromyalgia but just have a little bit of pain, and then... Okay.
So if you think of it as a volume, the volume's turned up a bit. Some people's turned up really loudly. So, something that you or I would think, gee, how did they get hurt? How could that hurts them? Because they've done SPECT scans of the brain, and it shows that the brain gets lit up on both sides of the brain, whereas in a normal individual, it'll just light up on one side of the brain.
You mean you're doing tests like if they just, you touched me earlier and just pressing my arm, that would be extremely painful for somebody that's on that far right end of the spectrum of fibromyalgia.
Exactly. So a strain injury to them becomes a really significant pain, and often very disabling pain.
What is fibromyalgia?
So fibromyalgia is just that. It is central sensitization. It is the pain signals turned up too loudly for whatever reason. And usually they've had a number of traumas or injuries. Okay. They may have emotional factors too that play into it. But for whatever reason, that brain is listening too loudly to the pain. So you have to try and decrease whatever pain generators you can and allow them to adapt and get moving, because movement will help to lessen that pain over time.
From what I understand about fibromyalgia, there are certain pain points on the body. Is that still relevant?
They've actually discarded that now, because you could actually press on them in any area and you're going to find that the pain signal is increased. So we're not really counting pain points or tender points anymore. And we're just saying that person, by definition, has the signal turned up.
So in your opinion, what are the best treatments for fibro?
Again, it's multifactorial, so you may need some medications, or some medications that may be helpful. You may need physical treatment, so if you have mechanical neck or back pain, you want to deal with that as well. You want to deal with myofascial pain, deep muscle pain as well, trigger points or tender points, acupuncture, massage, osteopathic care, chiropractic, physiotherapy. And then you want to deal with the emotional side of pain, help them to learn to manage their pain and get moving with pain. We used to tell people with fibromyalgia, even 10 or 15 years ago, not to exercise, and now we know that that's a downward slope if you do that. But you can get them exercising. Even if you can tell them, we want you to start exercising, they say, gee, I can't do anything. Start with 1 or 2 minutes a day. I just want you to go for a 1 or 2 minute walk. And every week for the next year, add 1 minute. So 2 minutes, 3 minutes. By the end of the year, you'll be close to an hour of walking a day. It's achievable. It's a goal that they can make happen, and it will help them to lessen their pain overall.
Why was it that we were saying no exercise, and why has that changed?
Because oftentimes people would exercise and they may exercise too much, and then that would actually make their pain worse. So you have to pace they have to pace themselves properly, because many times these people are highly functioning individuals who just now cannot do it, and they think that more is better, and it not necessarily is, but function is. The only thing I can guarantee a pain patient, no matter what the cause, is if you don't keep functioning in spite of chronic pain, you'll get worse and more disabled over time. So movement, getting re-engaged in life is important. Social contact, all the things that is part of normal life, these patients often have had altered.
They've had them altered because of, like you were saying, they're marginalized by society. We don't want to hear about all this pain. People want to just stay home because they're in pain. They're also being judged by others, especially when, in the case of fibromyalgia, people are saying, that wouldn't hurt me. Why would that hurt you? But what we learned, you invited us, Roger and I got to attend your amazing pain day where you invited incredible speakers from all over the world. And so we learned a little bit about more about pain, and learning that just because somebody somebody experiences pain in this way, that's just the way they experience it. It can be completely different for the next person.
Exactly.
So you showed us some x-rays on that day, and we were seeing two people's knees, both of them bone on bone. One patient saying he felt absolutely no pain whatsoever, even though he should by rights, looking at that x-ray. And the woman on the right, the exact same situation, bone on bone, no cartilage, was in agony. And so it just really showed me that people experience pain very differently. Some people just, like you were talking about that amplifier, they have it turned way down.
And I think we often look at imaging to solve our pain for us. And even MRIs, CT scans, x-rays, we know that the correlation between those x-ray findings and chronic pain are very poor. So the case we gave you, the osteoarthritis in the knee, the best doctors in the world cannot look at an imaging study and tell you who has pain and what degree of pain they have. And some people will have no pain, and some people have a great deal of pain. And so if you go in a doctor's office and he says, yes, you've got bone on bone, therefore you in your mind tell you, well, then I should have a lot of pain, shouldn't I? And I think we doctors have to get better about expressing that and saying that that's an x-ray finding only. We have to put it in the context of the entire person.
Yeah. So an x-ray does not give you all of the information. It shows you as an MD, you look at that and you think that you might know what that person might be experiencing, but it may not be.
And it sometimes gets them trapped into thinking, gee, I've got a disc problem there, therefore I should have back pain. Well, no, there are lots of people around there who have disc problems that really don't cause them any pain at all. So you can't label the pain according to the x-ray finding or the imaging study.
Something else that I found fascinating at Pain Day was that someone was saying that not necessarily having the surgery helps. In like 30 to 40% of cases, it really doesn't help. Or I think in 30% of cases, it does help. And 70% of cases, the surgery doesn't work.
Yeah, at the pain clinic, we see a lot of people with post-surgical pain, and the problem is the individual, again, thinks that the problem is that disc. So if I just get that disc fixed, it's going to take the pain away. And there's so many other factors. It's often the disc is not the reason the person's having pain. It's how they've adapted to it. It's the muscles, ligaments, and tendons and myofascial tissue around it that have tightened up, and that's causing more of the pain. So they may have the surgery thinking that that's going to take the pain away, and unfortunately it doesn't in most cases.
Wow.
So they're getting more selective now at identifying who would benefit from surgery.
I'm really glad that they are, because I just feel that sometimes you just hear that people have gone back in for 2 and 3 different surgeries and are still in agony, like an 8 out of 10 on a regular day. Mm-hmm. Wow.
So that tells us that they were not a surgical candidate, really, that was not a good treatment choice for them.
Acute versus chronic pain. Chronic pain is when it lasts 3 to 6 months, is that right?
Yes, outside of the normal healing time.
So if somebody is in, let's say, a car accident, they were a perfectly healthy person prior to the car accident, they have a bad car accident, someone else has hit them, mm-hmm. Now they are, they experience some kind of damage to their body, a back injury, whiplash, whatever the case may be. I can imagine then that, like we're talking about, the biopsychosocial effects of pain, that there is a lot of anger and frustration and resentment when you didn't do anything to cause that. Like I imagine that you deal with that a lot in your practice, where people will say, you know, it's my own fault. I did this and that and this and whatever it is, and now I've developed arthritis. I use my hands all the time, and now I have arthritis in my hands. But somebody else, that they feel like it's been done to them. Can you speak to those feelings?
Well, yeah, yes. If they feel resentful about why they've been a victim and that, and that's where the psychological aspect of it has to be dealt with, because the injury is the same. It's just how they've dealt with it from an emotional factor that contributes to their experience of pain. It doesn't mean their pain's not real. It doesn't mean that they're not disabled or impaired by that pain. It just means that they have to start thinking differently about how that pain experience has been to them, and that's where psychological intervention is extremely helpful.
Absolutely. And do you find that for most of your patients, they really do benefit from having a therapist that they can talk to about their problems?
Well, I think that would be great, but the reality is, and the truth is, that most people don't have access to that form of care. It's expensive, and unless you have a drug benefits plan, and even with a drug benefits plan, it doesn't pay for a lot. So if you become disabled because of it, you no longer have an income. It's extremely hard for those people to get access to those services.
Wow. So I think that's a huge social issue that is really not talked about that much. And I know that after the break, we're going to talk a bit more about, or we're going to talk about medication. I imagine then that for a lot of people that can't afford physiotherapy, acupuncture, massage, you know, all of these other treatments that you're talking about, chiropractic, that they simply go to medication because that's what's affordable.
Absolutely. And I think that's a problem in our system.
I think that's a problem in our system too. So people don't have, so I think that a lot of people that are watching online are from the US, and they think that in Canada we just have across the board free healthcare for everything, and that's just simply not the case. No. Are things changing in that way?
No, I would not say they're changing for the positive. No, I think it's not getting easier to get those services. When you're looking at a government that's strapped with a lot of health costs, they're looking to cut costs, not add costs. And I think they have to rethink the use of the resources in our healthcare system, and start thinking about physical treatment as being, physical and psychological treatment being more important.
I mean, I couldn't agree with you more. I think that we really have to go there. We've got about 2 minutes, so I think we might be able to get to what are your thoughts on opioids, medication? Go for it.
I think that, you know, with the opioid epidemic that's out there right now, a lot of people think opioids are just absolutely horrible. And I think the pendulum swung from opioids are you know, a wonder drug to opioids are now the scourge. The truth is likely somewhere in between. I've seen people whose lives are literally turned around. They got their life back by being on a reasonable dose of opioids that their doctor was not prepared to prescribe. And that lady came in, and we put her on a reasonable dose, well within the guidelines, and she has her life was turned around. She's able to attend her son's basketball game, which was the first time in 10 years she'd been able to do that, and it, you know, really turned her life around. I think it's how you use the medications, and judicious use of medications, I think, has a purpose. The goal with any time you put a patient on medication is to temporize for a period of time and look to eventually trying to get them off that medication. Sometimes, again, depending on the length of time they've been on it, it's more difficult than others. But opioids have a place, as do all other drugs that we use.
Amazing. More with Dr. Balon when we come back in a moment.
You're watching Rogers TV.
Welcome back. If you're just joining us, we're talking about pain on this show, and I've got Dr. Jeff Balon from the Centers for Pain Management helping us understand pain better and how we might be able to find some relief if we are suffering. So prior to the break, we were talking about opioids and medication, and that they do have a place for a lot of people. When should someone sort of decide when they've had enough of it, or like how long should it take for a medication to sort of take? And then let's talk about alternative treatments and how long should we let them go on before we sort of make other decisions?
Well, I think first of all we should cover what are our expectations with any treatment we have out there, including opioids. So let me ask you a question. So if you were going to be put on a pain medication because you had chronic back pain, what would you expect that opioid medication to do for you? What would you expect it to relieve if your pain was like an 8 or 9 out of 10?
If it's an 8 or 9 out of 10, I think that if I was going to be taking an opioid, I would expect it to get down to a 2 or a 3.
And I think that's what most people would think. And unfortunately, that's not what the studies show. Most of the studies in opioids for chronic pain have been over a 4-month period of time. And the best study, the best results is a 30% decrease. So that would typically bring the pain down from a 8 or 9 to 6 or 7 out of 10.
Wow. So I really, I don't mean to say wow like that, but I really think that people believe that if they are going to be on a medication, that the pain will all but be relieved by taking that medication.
And I think that's part of the problem, the expectation that people have. So any treatment at all, they want the pain to go away. They want it ideally not even to be a 2 or a 3. They want it to be a 0 out of 10. Mm-hmm. We forget that pain has a very positive function in our body. Without pain, we would not be able to survive very easily. So even when you're sitting there right now, if you sit there for too long, you'll get a pain signal telling you need to move and change position. So it's a very useful function. So our goal is to bring the pain down to a reasonable level that you can function at. So if you get a 30% decrease in pain, the trap that people and doctors fall into is that, gee, if it did that much at that dose, if I double the dose, maybe instead of a 6 or 7 out of 10, it's going to be down to a 4 or a 3 out of 10. And that ends up creating more problems than it does. So you may have had the best result from that pain medication at the lowest dose. And then you look at that to bring it down to level so that then you can start functioning and moving and getting re-engaged in life rather than expecting that to go down to a 0 or 1 or 2.
So you're suggesting then, so we can take the medication at the same time we're taking a multidisciplinary approach. We're doing acupuncture, chiropractic, if we can afford to do it. Yeah. Okay. And then when should we decide? Let's say we try acupuncture because you suggest to us that you think that's going to be a good way for us to work with our pain. How many sessions of acupuncture do I do if it's not feeling like it's improving? How long do I keep going?
That's a really good point. Whether it's chiro, physio, acupuncture, massage, any of those treatment approaches, I think if you give it a reasonable 8 or 12 weeks of time and you're not seeing functional improvement, it's time for that practitioner to either send you on or try something different. So doing the same thing for another 8, 10, 12 weeks or 6 months is not going to get you any better. So try something. If that's not working, try something different and just never give up hope. Never think that something's not going to work for you just because something didn't work in the past. And the type of care you have is important too. Whenever I send people for physiotherapy or chiropractic care, mobilization and manipulation plus deep myofascial work plus exercise. And big emphasis on the exercise piece. All of this is meant to get you more active and get you more functional and re-engaged in life.
I respect so much that you're bringing exercise into it because bodies are designed to move. We are meant to move. So I love that a big part of your work is getting people back into being able to know that even if they are experiencing pain, that little bits of movement, like you were talking about with people with fibro, that is a good thing, that just to keep adding on a little bit more and a little bit more, and success breeds success.
Exactly. Not being afraid to move because something hurts.
Yeah. Not being afraid to move because something hurts. So your suggestion then is, if people are in pain, we can still take those baby steps. You're still going to be in pain, but the more you take those steps, hopefully the less pain down the road?
Yes, and then the more fit that you'll get, you'll break up adhesions, you'll get some core strength back again. And it's got to be the right exercise, obviously, but you've got to keep trying, never give up trying.
Oh my gosh, well everyone needs to come and see you, but if they can't, they need to find somebody in their neck of the woods that really understands pain. We don't have much time left. I want to talk about the role of nutrition when it comes to helping people manage their pain.
So nutrition is a foundation for health, period, and it's even more important when you've got chronic pain. You need your body to be able heal and repair, and that takes healthy foods. A couple things that I think are really important. I get a lot of my patients to get off of gluten, getting off of wheat products, because it's pro-inflammatory in virtually all of us. And it's a low-cost, low-risk intervention to try getting off of gluten, because if you've got an inflammatory pain, particularly if you've got fibromyalgia or centrally sensitized pain, where every day something hurts and you're just sore everywhere, getting off of a food that may be a trigger, gluten being one of the more common ones. And I've seen people who've really had remarkable changes by getting off of foods, getting off of simple sugars, carbs, sometimes getting off of dairy, but just try things. There's no harm in trying something for 4 weeks, seeing if it helps, see if you feel better. If not, then move on to something else.
But I think at the end of the day, you're talking about really using real whole foods as medicine.
Absolutely.
For the body. I mean, I think Hippocrates said it perfectly well when he said, let food be thy medicine and medicine be thy food.
Absolutely.
Oh my gosh. Well, thank you so much for all of this. Let's leave on one note. You've got 30 seconds. Tell people what you want them to know.
Well, I think the main thing is never give up hope. And if you're not getting the answers or the attention that you think you should from a practitioner, be it a physician, chiro, or physio, try somebody different. Never give up hope. And don't let other people tell you how you should be either. And look for supportive people. And exercise, I've got to put that out there again. That's one of the key themes. Keep moving. Try and move and do things.
Amazing. Thank you so much, Dr. Balon. When we come back, I'll have Roger Deveau with me. Back in a moment. Beautiful. Don't get up yet. Welcome back to Real Talk with Sarah. We're talking about pain on this show, and I've got my partner Roger Deveau with me to share from personal experience how an all-natural pain relief product has helped his entire family alleviate their pain. Welcome, Roger.
I'm excited to be back.
So full disclosure, what we're going to talk about today is, a family product, a family business. But before we get into it, I want you to share your personal story of pain.
I hurt my back years and years ago, I think probably 10, 12 years ago. And back then it was just, I hurt my back. I'm pretty much out of mobility, but that was just now my new life.
Your new normal.
And for years I suffered, and it turned into really bad sciatica. Like I couldn't sit for long times, driving was difficult. I was in school at the time and I had to stand in my classes. It was just horrible. It was a real, not a very fun way to be. And it took years for that pain to subside enough to the point where I can kind of get back to life. But this sciatic pain stuck with me. And it would get to the point where I couldn't walk properly. I couldn't straighten my leg. And it was only till finally that I was able to, using this product that we ended up creating as a family, get enough relief to, like Dr. Balon said in the beginning, get myself to be able to keep moving, get myself to exercise, get myself to start strengthening my core. And as I did those things, for the first time in years, finally that pain went away. And I've been pretty much pain-free since.
Okay, well, I'm just realizing we didn't open these, so maybe that would have been a good idea to open them. But we don't even have to necessarily open it if I can't get it open. But so what is this product? Let's tell people about it.
So this is a pain balm that my family created about 5 or 6 years ago now. And like everything that we make, it's usually a family issue that we're feeling. And we look at it and we go, okay, what in nature, what can naturally heal this issue? The first product way back in the day was when my brother and I were teenagers. We made an acne ointment.
Okay, so your family owns an all-natural skincare line called Lemon Balm Lane.
Yeah.
And the first product was an acne relief ointment because you guys were going through puberty and your mom and dad developed this recipe.
Yeah, and looking for a natural way to cure the problem.
Right.
And so about 6 years ago, my mom was waiting for a knee replacement. And because of her age, she was in agony, just no more cartilage in her knees. But because of her age, the doctor said she needed to wait a couple of years to get the surgery. She was too young. and she was in agony. I mean, I was wheeling her around in a wheelchair. She had double canes to walk. Her quality of life wasn't very great.
Yeah.
And so we went back to the drawing board and said, what can we do naturally to help relieve this pain? And that's when we came up with this pain balm.
Right. And the first one that you came up with was this regular strength pain relief butter that now you use for people that suffer with migraine headaches or headaches.
And so what happened was we made that, and it was for my mom's knee pain, and you just rub it on the spot. It's got a bunch of natural, really just anti-inflammatories in it. So its main base is like there's eucalyptus, camphor crystals, menthol, rosemary, a lot of natural anti-inflammatories.
Right.
And so she would just rub it on her knees, and it got rid of a lot of the pain and allowed her to keep moving and got through those 2 years waiting for her surgery.
Right.
And this is the exact one actually that I used for my back pain as well. So my mom ended up getting her knees replaced, both of them. And because of using this, she was able to, after the surgery, do the physio, keep the movement, and she was only in physio for just over 3 weeks until she was able to stop. She had full range of motion back in her legs because she was able to get rid of the pain and keep moving.
Yeah, and I can say, I mean, I know your mom, obviously. Yeah. The difference has been absolutely remarkable in her. And so she developed the extra strength pain relief butter because, and she added yarrow and arnica, which are 2 natural anti-inflammatories.
Yeah, and both have been shown to really reduce inflammation and swelling. And I mean, yarrow was from the Navajo called life medicine, and they used it to get rid of pain. They used it for toothaches, ear infections, things like that. So it's just all natural products that basically all it wants to do, the herbs that are in it, want to just reduce tension and inflammation. And so much of pain, as Dr. Balon was even saying earlier, we think it's that disc, but it becomes all the muscles and the fascia and everything around it that tenses and gets inflamed, and that's our pain. And so we found that pretty much any pain that someone's feeling, these will actually help. So we've had people ended up using my sciatic pain. I was looking like, look what that did for my mom. I got to try this. And I would barely be able to walk up to it, rub it on my back and in my sciatic, and within 45 seconds, a minute, I'm walking away, and that's why I was able to exercise.
And it's so funny because it's a family business. Yeah. You and I have both experienced it where I'll be like, I have a headache, and you'll say, I guess you should rub pain butter on, and I'll rub it on thinking, you know, we sort of we surprise ourselves every time it works so well.
It's funny you bring that up because it took me a little while. I didn't write, they created it and go, all right, now we've made it, we need to use this for every pain that we have. And with a lot of the products that we make, it's funny when it's your own thing, you don't normally think of it right away. But we've had people start using it, well, will this work for my migraines? I don't know, try. And they would try, and their migraines were gone within minutes. And people they were on disability from work, they would have to take 3-4 days off at a time, now back at work. We've had people with workplace injuries where their feet were crushed, and in the last decade, they've just been in agony, trouble walking. Rub this on at a show while we're there, and come back 10 minutes later saying, this is the most relief they've felt in a long time.
It is amazing. It's the Lemon Balm Lane Pain Relief Butter. You can order it online at their website, lemonbalmlane.com. You and I both have witnessed thousands of testimonials, I would imagine. When we come back, I'll have healer and medium Marie-Lune Fortin with me to talk about the emotional side of pain. Back in a moment. Welcome back to Real Talk. We're talking about pain on this episode, and I've got healer and medium Marie-Lune Fortin with me to help us understand the emotional side of pain. Welcome back, Marie-Lune.
Thank you.
I'm so
happy
happy
me again.
Nah, I'm happy to have you back again. You and Roger both back again. This is a fun episode. I like it. Yeah. So you have a personal story of how you went through some really emotional pain, and then I want to talk about how healing helps us with physical pain as well. But let's start with your story.
For sure. And before I start, I wanted to make sure people understand that my reasoning for sharing my personal story is later when we're going to speak about pain. I want them to understand that I understand and I truly, truly do, and it comes from a very true place. So I'm not just, using words, you know. So about 3 years ago, in 2015, at the end of 2015, I had a burnout, and then I just continued working like many of us do, because we don't know we have a burnout. And the continuation of that, I was very tired, and then some I guess it was always there, but because I was just so tired, it really started to come up to the surface. And for me, what came up is that I developed OCD. Now, often OCD, people believe that it is a physical thing. People have to wash their hands or just
turn off lights.
Exactly, do things, you know, more than once. And
so we're saying obsessive compulsive disorder,
so
OCD,
much.
just in case people didn't catch it. Okay.
Yeah, and for me though, it was with thoughts. So it was with intrusive thoughts. So it was about just believing things over and over again, but things that I hadn't done, but thought that, you know, I had done terrible things, and I couldn't figure it out if it was right, if I had done it or if I hadn't done it. It was to that point. It brought it had an impact on my whole entire being. So especially, it really did physically. I lost a lot of weight. I went to adrenal fatigue, which is something really hard to come back from. And mentally, it was just absolutely what I called it, pretty much hell on earth. It really got me in a place where I couldn't get out of my home anymore, and I couldn't even look at people. I couldn't watch TV. I couldn't read. I could only just be with me, and even being with me was absolutely terrible because I was with my thoughts, you know. So with OCD, also what showed up was PTSD, so post-traumatic
stress disorder.
Thank you so much.
Yeah.
For me, it from a series of traumas that occurred since I was a kid, and then continued as I got older. And they were all quite different, but they were very, very big traumatic events all the way into my 30s. So it was a perfect storm for all of that to come up, and it all came up at the same time. The pain was definitely, it was atrocious, and it was to the point where it's not that I wanted to leave the planet, but I definitely wanted the suffering to end.
Yes.
And that was the lowest point for me, where I was to the point of committing the act, you know, of not wanting to be here. And at the time, you know, my ex-husband stepped in and made sure that that did not happen. So I was very, very, very grateful for that. Yeah.
That's an incredible amount of pain that someone needs to be in, and in this case, you were in. And I think that's a real misconception when people think about suicide. They think that how could that person leave all of those people behind, and how insensitive, how selfish.
Yeah.
And yet really all that's happening is the person in that much pain is just simply wanting the pain to stop. Like you said, you didn't necessarily want to die.
No.
You just did not want to keep living that way with that much pain anymore.
Yep.
So tell us, how are you now sitting with me as a healer, clearly having come through PTSD and OCD and no longer at all wanting to leave this planet?
Yeah, no, quite the opposite, actually. I definitely surrounded myself by a beautiful team that I handpicked. And when I started, I wanted to find healers, because they're all healers as well. We all do it in different ways. So healers that were for their own specific areas. So I look for someone spiritually to support me. I look for someone on the physical side and on the mental side as well. So I just started working with them, and one of my questions that I would ask them was when I got it started, because I am quite a determined person. That is something that when you are in a place of needing healing, there's an amount of work that needs to be done, and the work comes from us. So nobody really heals us, right? The healer doesn't heal us. We heal ourselves we just get assisted by those beautiful souls that helps us here on earth. But I remember asking them, do you believe are you here to help me cope or manage? To help me cope or heal? And if I would get the answer of coping, I would say, I'm sorry, we're not a good match. Because I really I was definitely gonna get through this, you know?
So they were sort of tempering your expectations by just saying, we're just gonna help you to cope with it, because they were afraid to maybe say, we're gonna help you to heal, because that puts a lot of pressure on them as a healer, maybe.
Yep.
Yeah, and a lot of pressure on you as the patient or the client. Yeah.
But I needed them to believe it as much as I did.
Yes.
You know, so I did that work, and it was a lot of work. It never ends, you know.
Yeah.
But definitely, I am in a different place. I am in all of what I went through. It became a catalyst for me to now sit in front of you and being able to share how I can now assist other people in my role.
Well, and you have such a breadth of knowledge now. And I'm privy to know that you did chiropractic care.
Yes.
You did some equine therapy.
Yep.
You did massage therapy, acupuncture. So you really threw everything at it. And I think that's a really big message for tonight. And what Dr. Balon was also saying, try different things.
Yes.
And don't give up on them right away.
Yep.
You know, if they're not working after 8, 10, 12 weeks, well, then maybe look for something else, but give things a chance.
It's to find your recipe.
Yes.
That's how I would put it. Find because we're all different people and we all work the different ways. And and just like the doctor was explaining, we all have different levels of sensitivities, right? So for someone who works with maybe hands-on healings, that might not be what they are really looking for. And for somebody else, it might be the only thing that really brings them the relief that they're looking for. So find your own recipe, keep trying. I totally agree with the wonderful doctor that, you know, don't give up. Don't give up.
Yeah, don't give up. So you mentioned earlier that we are the healers.
Yes.
Each of us is the healer. How then do you, as a healer, help us to heal?
Yes. So what I get to do is I get to connect with someone's energy. I get to have a glimpse into how they are energetically. And I get a glimpse of where they're at mentally, emotionally, spiritually, and physically. And how I get to have that is just by pure, you know, intuition. My sensitivity is what allows me to be able to connect to that vibration. So we all work on different vibrations in our lives, and a lot of the sensitive people can really connect with people's vibrations and frequency. So that's what I do. I connect with that frequency. When I deal with people who have chronic pains, which pretty much what is my area of expertise as a healer is with chronic pain. So is to, I connect with the pain. Then I don't go in knowing exactly what's going to happen. I let it show itself to me. So often the first step, though, there's been, now that I've had quite a few clients and I know how it kind of goes, the first step is to remove inflammation, diminish it, and remove it.
And so you're doing that energetically?
Yes.
Yes, okay.
Yes.
So we're talking about physical pain, chronic pain.
Yep.
You can help people to remove their chronic pain through working with people.
Exactly.
And I know it works because you've done work with Roger and it was amazing. And you've done work with me. You helped me to heal a hernia. I had a tiny hernia and I haven't had any issues since you worked with me.
Oh, I didn't know that. That's awesome.
But keep going, keep going. Tell us more.
Yeah. So inflammation is the first one. What I've learned is that once inflammation is lowered, you can really get started on the healing process.
So let's sort of interrupt, but how many sessions would it take to get to lower that inflammation to be able to take the next step?
Usually right away. So it's a process that so far has taken between 10 to 15 minutes with someone to go from working that inflammation to lower it down to the steps that come after that.
Okay.
Yeah, so it can work pretty quickly.
That's incredible.
Yeah.
So keep going with the steps that come after.
So the second step is that I then usually when there is inflammation, the body tries to protect itself. So the muscles, how we're holding ourselves, there's a lot of muscles that are definitely really tense. So what I do is that I go in and energetically loosen up those muscle fibers. And if there are some muscles that actually need more tightening because they haven't been able to be worked out, if you've been hurting, then I kind of tighten some of those to be really able to help and hold things together. And the last part, usually what I'm getting is a word. So I get an emotion, I get a word that will be showed to me on someone's energy center. So I'm talking about the chakras here. So for those who don't know what that is, it's we have many of those, but we're working mainly with 7 of them. They are energy centers in our bodies, and they all are tapped into different areas of our body's mind and soul. So once I see that word, that gives me an idea of what is the emotional root cause of the pain. And so then we talk about it with my client, and then we go even further than that. Then we go into where is that emotional root cause from? So the cause of the cause. So we're going even further. When did that start showing up, that feeling, that emotion? Usually it takes me with the client into when they were really young. And then this is where everything is different for everyone at that point. Mm-hmm.
What an incredible process. And like I say, I have witnessed it in my own experience. And Roger, you did this with him over the phone. Mm-hmm. It was incredible. So for anyone watching, Marie-Lune does remote work. So get on the phone with her, do a Skype call. Oh my gosh, the work you do is amazing. Okay, we don't have much time. We have about 2 minutes left. And I know that you have some tips for us if we are going through emotional pain. So some steps we can take with if we are going through any kind of pain, mental, emotional, and physical. Number 1, acknowledge the pain.
Yes.
Okay.
So acknowledging it is what will get you to the last point. Eventually would be able to let go. Acknowledging something is to look at it for what it is without judging it. And it's just to even say, it's here. I am in pain, And that step, what's really important is to stay positive though.
Yeah, and to stay out of denial, I guess.
Yes.
Yeah.
Yeah. So when I mean being positive, I don't mean to be, okay, I'm going to get through this, everything's fine, it's not that kind of self-talk we're talking about. What I'm talking about is to acknowledge and be, right now, it really, really is difficult, but I know that there's a way.
Okay. Number 2, sit with the pain.
Yes. So this is one of the most important one, is to actually take the time to sit calmly and really be with it, to feel it for what it is.
Okay.
It's uncomfortable, but it's an important step.
And number 3, breathe to release.
Yes. So to be able to then, as you felt it, start to breathe into that and start to really let an emotion come up. When the emotion comes up, then we'll be able to release it at that point.
And number 4, let it go.
Exactly. And let it go is not even the releasing of it. Letting go, I'm even going to the point of, we have worked this through. I've let the pain, I've let the sadness, I've let the anger come up, work its way through me, run its course. Now I'm going to go and change and do something else.
You're amazing, Marie-Lune. Merci beaucoup. Thank you so much for being here. When we come back, I'll share my final thoughts. Back in a moment. My maternal grandmother, who I called Nana, was in chronic pain. She had both of her knees replaced more than once, and I can still hear the shrill sound of her cries, and then her immediate, I'm okay, when she would sit for too long and not be able to get up without the help of a person or an object to steady her. It was hard to witness both her pain and her embarrassment for being in pain, and I can only imagine how she must have felt both emotionally and physically as she spent decades in agony. Like many of you watching understand, pain can be frustrating, isolating, and of course, painful. It is my sincere wish that something you've learned today will provide even a glimmer of hope that things can change for the better. Thank you to my guest, Dr. Jeff Balon, for helping us understand the ways people experience chronic pain and the biological, psychological, and social effects, along with ways we might be able to improve our situation if we are suffering. It's important to note that we can all do better at having greater compassion for those in pain. Thank you to Roger Deveau for sharing his story and his family's pain relief product. We hope you might consider it as another tool in your toolbox. And thank you to Marie-Lune Fortin for coming back on the show to explain how our emotions are tied to the sensations in our body, including the pain we experience. And thank you for being here to learn alongside us as we explore these important topics together. Until next time, I want you to remember one thing, that no matter where you are and no matter how it feels, you are never, ever alone. See you next time. Thank you so much.